Hello, my name is Bob Jokela, Superintendent of Fitchburg Public Schools. I'm here today with an important announcement on the hybrid return of learning for our students. I'm thrilled to announce the start of an in-person learning under our previously announced hybrid plan. All teachers and some Cohort C students will return to our schools on Monday, February 22nd. Cohort A students will begin in-person learning on Monday, March 1. Cohort B students will begin in-person learning on Thursday, March 4. Cohort D students will continue remote learning on Monday, March 1. Fitchburg Public Schools has partnered with Concentric by Ginkgo to perform pooled or group testing of up to 10 individuals in a class consisting of staff and students. Group COVID-19 testing is used as a virus safety measure to identify individuals who are carrying the COVID-19 virus. The group or pool testing will begin on Monday, March 1. We will be contacting parents of Cohort A, B, and C students to complete parental consent forms to allow their child to participate in pool testing. We will continue to be transparent and provide additional information to the entire Fitchburg Public Schools community in the days and weeks to follow. We thank everyone for your strength, vigilance, and patience during this pandemic. We continue to take steps to return a more normal routine and look forward to helping everyone make a smooth transition. Also, thank you for taking the appropriate steps to reduce the spread of the virus in our community. Please continue to wash your hands, wear your face masks, and socially distance. Be safe, Fitchburg, and we can't wait to see some of our students back in school starting in March. As a reminder, I also want to share with the Fitchburg parent community and student community the start and dismissal times of schools in the hybrid model. Also, we'll be sharing an introduction to pool testing provided by our partner, Concentric by Ginkgo. Thank you.
Hola, mi nombre es Bob Jokela y soy el superintendente de las escuelas de Fitchburg. Estoy aquí con un importante anuncio sobre el regreso híbrido a las escuelas de nuestros estudiantes. Estamos encantados de anunciar el inicio del aprendizaje en persona bajo nuestro plan híbrido previamente anunciado. Todos los maestros estudiantes de la cohorte C o grupo C regresarán a nuestras escuelas el lunes 22 de febrero. Los estudiantes de la cohorte o grupo A comenzarán el aprendizaje en persona el lunes 1 de marzo. Los estudiantes de la cohorte B o grupo B comenzarán el aprendizaje en persona el jueves 4 de marzo. Los estudiantes de la cohorte o grupo D continuarán con el aprendizaje remoto el lunes 1 de marzo. Las escuelas públicas de Fitchburg se han asociado con Concentric by Ginkgo para realizar pruebas agrupadas o grupales de hasta 10 personas en una clase compuesta por personal y estudiantes. La prueba del grupo COVID se utiliza como medida de seguridad del virus para identificar las personas que portan el mismo. Pronto nos comunicaremos con los padres de los estudiantes de los cohortes o grupo A, B y C para completar los formularios de consentimiento que los padres deben llenar para permitir que su hijo participe en las pruebas conjuntas. Continuaremos siendo transparentes y brindaremos información adicional a toda la comunidad de las escuelas públicas de Fitchburg en los días y semanas siguientes. Agradecemos a todos por su paciencia durante esta pandemia. Además, gracias por tomar las medidas adecuadas para reducir la propagación del virus en nuestra comunidad. Continúe lavándose las manos, utilice la mascarilla y practique el distanciamiento social. Manténgase a salvo. Estamos ansiosos de ver a nuestros estudiantes de regreso en la escuela a partir de marzo. Como recordatorio, quiero compartir con los padres de la comunidad y los estudiantes los horarios de entrada y salida de las escuelas en el modelo híbrido. Para la escuela Crocker, Rangel y South Street entraremos a las 8:15 de la mañana y saldremos a las 2:35. Para la escuela Lonjo, Memorial y McKay Arts Academy empezarán a las 7:30 de la mañana y saldrán a la 1:50. Para Fitchburg High School empezarán a las 8:30 y saldrán a las 3:05, y para la Academia Goodrich empezarán de 12:15 a 7:30, solo 3 sesiones. Además, queremos compartir un video de nuestros aliados Concentric by Ginkgo sobre las pruebas grupales.
Hi everyone, we're excited to have you join our pooled classroom testing program. In this training, I will introduce classroom pooling and walk you through how this program can be easily implemented at your school. The current pandemic has tested all of us. Routine pool testing is a solution that could help us gain information about infection at a community or population level. As we think about what large subset of the population really needs pooled testing, K-12 education immediately comes to mind. There are approximately 60 million students and staff in this population. Many believe that routine testing on a weekly basis may allow us to return to in-person learning in a way that safeguards everyone's health. Several news outlets have mentioned pool testing as a way to extend limited resources and expand access to testing to many Americans, especially in K-12 schools. At Concentric, we built our classroom pooling program to be part of that solution. We launched our program not only to start bringing testing to schools across the nation, but to help us better understand the logistics of scaling this program to a national level. So what is classroom pooling? This method allows an entire classroom, between 5 to 25, to be tested together as a single unit. This dramatically reduces the cost of testing and simplifies the logistics of testing large groups of people. Our test is not a diagnostic test. Our pool test returns results at a classroom level for public health information, not for individuals in the classroom. So how is classroom pooling different from lab pooling? In lab pooling, individuals collect their samples in individual tubes, and the samples are combined in the lab. Classroom pooling combines samples at the front end, which limits the logistical burden of tracking each individual tube. From a scaling perspective, that makes classroom pooling a more feasible method to implement nationally. This pooling program can be broken down into 4 simple steps. To get started, your school must sign a testing agreement. Once an agreement is in place, we provide training materials and help you set up for test day. On test day, you will work with your school team to ensure that everything goes smoothly. After test day, you can expect to receive results within 48 hours after our lab has received your samples. There are multiple people involved in making the testing process go smoothly at your school. Parents provide consent for students to take the test if they are under 18. Administrators set up testing at the school. Teachers observe students collect their samples. Of course, students play the crucial role of providing the samples. We designed the test to be a simple self-collection process, but school nurses may be helpful if some test takers need assistance. For example, this could include very young or special needs students. At Concentric, we can help answer any questions you have along the way. Now I'd like to briefly introduce the 4 essential roles in the school team. For more detailed information, please see our Introduction to Essential Roles training video. In this testing program, the 4 essential roles are test champions, who are often superintendents or principals, test supervisors, often administrators, test observers, who can be teachers or school nurses, and test takers, who are students or teachers participating in testing. Here's a simplified view of the test day process. First, a test tube is uncapped in a holder like a coffee mug. Second, everyone in the class receives a sealed nasal swab, and the teacher or staff member observes as students collect their samples. After all swabs have been collected, the tube is capped, sterilized, and returned to a school administrator, who plays the role of test supervisor. What makes classroom pooling so easy to implement at schools is that it allows test takers to collect their own samples. The sample is collected using an anterior nasal swab, which is different from a nasopharyngeal swab, which needs to go all the way through the nostril until it touches the throat and needs to be administered by a trained healthcare provider. In this case, only the lower part of the nostril is swabbed, which makes testing more comfortable, allows for self-collection, and requires less PPE. Here are more detailed instructions for the sample collection process for both test takers and test observers. These documents will be available to you electronically. You may want to distribute this to your teachers and test takers as well. Test takers clean their hands and open an individually wrapped swab. Then, using a short swab, they collect a sample from the lower part of the nostril and then put the swab in the collection tube with the cotton side down. The instructions for test observers, who are often teachers or school nurses, are as follows. With clean hands, open the collection tube and place it upright in a holder like a coffee mug. Observe small groups of students as they self-swab and place their swabs in the collection tube. After all the students put their swabs in the collection tube, wearing gloves and a mask, close it, sanitize it, and then return it to a test supervisor, often a school administrator. We designed the process to be very simple and easy to do. In terms of time commitment, the whole process of testing an entire classroom can be done in 10 to 15 minutes. We've seen that after the first day, when people become more comfortable with the testing process, it goes even faster than that. This concludes the overview training for classroom pooling. If you have any questions, our team is here to help. To learn more or get in touch with a representative, please visit the Support Center or submit a support ticket. For this training session, I will walk you through the entire testing process from start to finish, including what needs to happen before, during, and after test day. I will not discuss the role of test takers in this session, but I will discuss the roles of test champions, test supervisors, and test observers in detail. Please review the materials presented here closely, since comfort and familiarity with these materials will be critical for running a successful testing program. In this section, I will walk you through what needs to be done before test day. Allocating enough time to prepare for testing will help ensure that everything goes smoothly. 3 essential roles must coordinate and work together to get ready for test day. Prior to testing, test champions will contract with Ginkgo, place orders for test kits, identify a test team, communicate with parents, and coordinate with test supervisors to distribute consent forms. Test supervisors should review onboarding and training documents since they play a critical role in managing test day. Test supervisors should also check that barcode scanners are working properly, manage consent forms, set up pooling groups, and coordinate supplies to ensure the school has everything it needs to collect samples on test day. Ideally, each classroom would be its own pool, but we do require a minimum of 5 samples per pool. So if a classroom doesn't meet this minimum, it might be necessary to group multiple classrooms together in one pool. For test observers, prior to testing, they should review the instructions for both test takers and for themselves, as well as remind and prep students for test day. Depending on the school's environment, we recommend spending at least a week preparing to ensure a successful test day. Prior to test day, it is important to make sure you have all required supplies. Here's a checklist of everything you need. Your school should provide a laptop, ideally with a USB port so it can be used with a barcode scanner, PPE. PPE is minimal for observed self-collection. Please follow CDC and state guidelines on required PPE. Cleaning supplies. Most schools already have hand sanitizer, disinfectant, and paper towels in each classroom. And any additional setup needed for testing stations. You can do sample collection in a classroom without setting up a new space, but if it's done elsewhere, like in a gymnasium or cafeteria, that may require additional setup. Concentric provides all materials for observed self-collection, shipping materials, pre-labeled return boxes, 1 barcode scanner for each school, and digital copies of instruction sheets. Test champions should be careful to ensure that the school's order is correct before placing it. One of the most important tasks to perform prior to test day is communication with parents. This is often done by the test champion, but test supervisors and test observers may also be involved. Classroom pooling may not be something that parents have been introduced to in the past, so it's important to communicate with them about the test, the process, and how the school will use the results. Concentric has written a comprehensive, frequently asked questions list for parents that can be used to aid in this conversation. Now I will switch gears and talk about what happens on test day. On test day, the role of the test champion is to work with the school team to make sure everything goes smoothly, and to coordinate with the test supervisor to ensure that the samples are mailed to the lab at the end of the day. Test supervisors play a hands-on managerial role. I will go through their responsibilities in greater detail in the next few slides. Test observers should ensure they have the necessary supplies to run testing either inside classrooms or at the central test location. Test observers will receive a roster of students who have returned consent forms and must only allow those students to provide a sample. Test observers watch students collect their samples and give the group samples to the test supervisor. Test supervisors should give test observers these instruction sheets along with collection kits prior to testing. It's critical that test observers fully understand the process so that they can give instructions and make sure that students correctly perform the swabs on their own. If a student drops their swab at any point, it is important that the test observer tells them to collect another sample with a clean swab. It is important that test supervisors set clear expectations for when test observers should deliver their pooled samples. Test supervisors should also confirm with test observers about how many swabs are in each tube, as this data is required for us to process the pooled samples. Detailed shipping instructions will be provided. Be sure to arrange a FedEx pickup in advance to ensure that the samples are shipped by the end of the day. We recommend that schools complete sample collection by noon to allow enough time to register and pack test kits. You can also drop off the shipment at a FedEx collection box if that's more convenient, but please do not drop off samples at a FedEx store, since FedEx stores cannot accept a package with a Category B substance label. We created this test day checklist to help guide you through each step. We recommend printing out this checklist and checking off each task to ensure that nothing has been missed. Now that you have made it successfully through test day, I will go over a bit about what happens next. After testing, only the test champion can view and download the results. For test supervisors and test observers, please coordinate with test champions on next steps. Results will be available on the Concentric website approximately 48 hours after the lab has received the sample. If for some reason there is a shipment delay, results will be delayed. To access results, test champions will need to log into the Concentric website. Since this is a pool test, results will only be returned to the pool, not for individual students. This is the end of the training session. As always, our team is here to support you through every step of the testing process. If you have any questions, please visit the support center or submit a support ticket. Thank you. In this training session, I will introduce you to the essential roles in classroom pooling. Each person involved in the testing process is essential to make classroom pooling go smoothly. The 4 essential roles are test champions, who are often superintendents or principals, test supervisors, often administrators, test observers, who can be teachers or school nurses, and test takers, who are students or teachers participating in testing. Test champions are individuals who serve as on-site internal coordinators, ensuring that the needed infrastructure, communication, and logistics are set up. These individuals also serve as the main points of contact for the Concentric team. Test champions will also receive access to test results. Test supervisors are the individuals who oversee the testing program before and on test days. These individuals register collection kits on the Concentric website, distribute collection kits, manage individual consents, track individuals in pools, and ensure samples are returned to the Ginkgo lab at the end of each testing day. Test observers oversee the classrooms on test days. These individuals observe students self-collect samples from a safe distance and ensure a smooth sample collection process inside a classroom or at a central collection spot at the site. In young individuals or individuals with special needs, a school nurse or healthcare professional can collect the sample. Lastly, test takers are individuals at your school, teachers, staff, and students who participate in classroom pooling. Some schools choose not to include staff and teachers who work in multiple classrooms in pools. To participate in testing, each individual, or their legal guardian for anyone under 18, must provide informed consent. It is important to note that anyone who has tested positive for COVID-19 in the last 3 months should not be included in a pool because this can result in a false positive. Now that the 4 roles have been introduced, it is important to identify the different levels of access that each role has in the Concentric website. Test champions are the only people who can view results and download historical test kit data. Test supervisors can register test kits, but do not have access to data or test results. As for test observers and test takers, these individuals will not have access to the Concentric website. I hope this training has been helpful in understanding the different roles in this testing program. For any additional questions, please visit the Support Center or submit a support ticket.
As a superintendent of schools, this has been an unusual time. This has tested all of us in our work, and the way we do work, the way we do school is fundamentally different than we've ever had to do it before.
I think that this year has been one of the hardest years for a lot of teachers in teaching.
What we are doing is being very careful and making sure that we are doing everything we can to keep our schools open and make in-person learning possible for our kids, while also trying to make sure that our adults and students are safe. Testing enables this additional layer of finding the virus before symptomatic students might show up or staff might show up, and adding a layer of protection against the spread in schools.
I'm a proponent for, pool testing as much as possible because I think it helps to identify, pockets of outbreaks sooner. So certainly if we can eliminate, opportunities for spread by testing whole groups of people, I think that's a benefit for us.
So in homeroom, our students, after they get their bags away, jackets away, get out their Chromebooks, they'll sanitize their hands, grab the swab, put it in their nose 4 times in each nostril. They will then place the swab in the tube, sanitize their hands, sit back at their desk.
We believe that in-person school, giving families that option and giving our children the option of coming into school in person as much as possible is in their best interest.
We can be more proactive about what is happening and what we can control to make sure that everyone's as safe as possible.
For right now, it's just been a pilot, and we've had parents actively involved in this as citizen scientists and helping to figure this out.
I'm hearing from the staff who have been in the classroom that the kids are interested, that they feel, excited about the chance to, participate in research and move something along.
We don't know when the vaccine is going to be available to us. We don't know when our teachers and then ultimately our students will have access. And so we think for the remainder of the school year, having a testing protocol is critical to our ability to continue to function as a school district.